So here we are going to talk about neurocognitive disorder. What is neurocognitive disorder? Neurocognitive disorder is a general term that is described the diseased mental function due to a medical disease other than a psychiatric illness. So neurocognitive disorder we basically call dementia, delirium, or Alzheimer's disease. Let me talk all of them one by one. Delirium or acute confusional state is a syndrome presented as severe confusion and disorientation, developing with relatively rapid onset and fluctuating in intensity. Delirium may be reversible or may last up to 6 months. So, delirium is a temporary mental state characterized by confusion, anxiety, incoherent speech, and hallucination. If you ask me, what are the common cause of delirium? So definitely sometimes, delirium is not always related to an underlying condition. It may be caused by fever, intoxication, certain medication, sleep deprivation, or emotional distress. What else? Dementia is a non-specific syndrome affecting memory, attention, language, and problem solving, and lasting more than 6 months. Also, later complicated by orientations and behavioral problems. 10% may be reversible cases. So dementia, basically, or also known as a major neurocognitive disorder. Dementia, a group of syndromes that affect memory, thinking, and interfere with daily life. So next page, we are going to compare and contrast delirium and dementia. Delirium is a rapid onset. You see the onset, cause, duration, consciousness, attention, memory, psychomotor change, and sleep-wake cycle. We're talking on based of these points. So onset, particularly dementia, it is a gradual onset. So insidious month to year. Delirium, rapid hour to days. So acute onset, whereas dementia is a gradual onset. Delirium is a transient and reversible. They say fluctuating. It is called sundowning if a sundown. It is reversible, days to weeks. Whereas the dementia, it is progressive, it is chronic, and irreversible, means month to year. Next, go the consciousness. So delirium, consciousness affected, but dementia, consciousness often normal. So level of consciousness remain unchanged in dementia, but level of consciousness alteration usually present in delirium. So in case of delirium, the causes include metabolic disorder and infection or toxic substance. Whereas the dementia, the cause usually causes by neurocognitive disorder, most common in Alzheimer patient. So what else? Attention often normal, but significant inattention and lack of concentration. What about the memories? Immediate recall often normal in dementia, but immediate recall impaired in delirium. Psychomotor change, not usually present. Delirium, hyperactive, and sleep-wake cycle often reversed. In case of dementia, often normal. So delirium here, it is disturbed behavior and easily distracted, sleep-wake disturbance, and hallucination is present. But it is transient, it is reversible. Dementia, normal behavior until advanced states, but it is chronic, it is progressive, and irreversible.